Bismillahirrahmanirrahim. Assalamu alaikum, dear students of first year MBBS, BDS, and DPT. This lecture is about the intervals and segments of ECG and their clinical importance. At the end of this lecture, you will be able to learn normal intervals in an ECG and their clinical importance in diagnosing heart blocks, electrolyte disturbances, myocardial infarction, that is one of the major causes of death all over the globe, abnormal rhythm of the ECG, and in calculation of heart rate from the ECG strip. The summary of spread of conduction of cardiac impulse from SA node to ventricles is that the point 1 in this diagram, it indicates spread of excitation from SA node, while the point 2, it indicates excitation of both atria, while the point 3, it indicates passage of impulse through AV node, while the point 4, it indicates conduction through bundle of His and its branches, and also through the Purkinje fibers. The point 5 in this diagram, it represents excitation of the ventricles, while the point 6, it represents repolarization of ventricles. The normal intervals that we are going to discuss in this lecture, these includes PR interval, then is QT interval, then is ST segment, and then is the RR interval between two R waves or QRS complexes. We will discuss these intervals and segments one by one in the next coming slides. So the first one is the PR interval. As this interval shows, it indicates the time between the start of P wave to the start of QRS complex or Q wave. The normal PR interval duration is 0.16 seconds and maximum normal duration is 0.20 seconds. That is, it is equal to 1 large square. And this normal PQ interval or PR interval is measured from onset of P wave to the onset of Q wave. But this interval is often called PR interval because the Q wave is absent in many components of 12 lead ECG. And this thing we will discuss in the next lecture, that is about the recording of electrical activity of the heart in the form of 12 lead ECG. The PR interval, it becomes prolonged as is seen in this first diagram. It becomes prolonged in case of vagal stimulation, increased parasympathetic activity, in case of atrioventricular blocks, and the most important reason of prolonged PR interval is hyperkalemia. And this is very important sign of hyperkalemia. If PR interval remains prolonged throughout the 12 lead ECG, then the condition is called first degree atrioventricular block. If the PR interval becomes progressively prolonged, as is shown in this diagram, that first it becomes long, then it becomes longer, then there is missing of R wave, means there is missing of beat, and that condition is labeled as second degree heart block or atrioventricular block. This second diagram, it indicates shortened PR interval, and in case of it occurs in case of hypokalemia. Sympathetic increased sympathetic stimulation. In case of accelerated atrioventricular conduction, and also in case of fever, or also in case of increased environmental temperature, or during exercise. The next is the QT interval, and QT interval, it represents the time from the beginning of QRS complex to the end of T wave, and this period, that is labeled as QT interval, it indicates ventricular systole, and this period or interval tells us how long ventricles will remain depolarized and in contraction state. The normal duration of QT interval is 0.35 seconds. The QT interval, it becomes prolonged as is shown in this diagram. It becomes prolonged in case of ventricular extrasystole, and secondly in case of hypocalcemia. This diagram shows shortened QT interval, and shortened QT interval occurs whenever heart rate increases. Secondly, the shortened QT interval occurs in case of hypercalcemia. Next is ST segment. ST segment is the segment from the end of S wave to the start of T wave. It is a segment from end of S wave to the start of T wave. ST segment represents plateau phase of ventricular muscle action potential, or ventricular phase of a plateau phase of ventricular muscle repolarization. During the ST segment, whole myocardium it becomes depolarized. Therefore, it appears as isoelectric line. The significance of ST segment is that any appreciable deviation of ST segment from normal indicates ischemic damage to the heart muscle, and that is called ischemic heart disease, and that is one of the major cause of death, and this is normal ST segment. And in this diagram we can see that the ST segment it is elevated, and in the same manner in this diagram the ST segment also appears as elevated, and this is classical sign of myocardial damage called myocardial infarction or ischemic heart disease. The next is RR interval, and the RR interval as we can see from this diagram, it is the interval between two successive R waves, and the RR interval, it represents time taken by one cardiac cycle to become completed. If the significance of RR interval is twofold. Number one, it helps in assessing it helps in assessing rhythm from ECG. Number two, it helps in determination of heart rate. If RR interval is constant, if RR interval is constant on ECG, then the rhythm is normal, and the normal rhythm is called sinus rhythm. If RR interval is not constant, as is shown in this diagram, this is one RR interval, and this is second RR interval. Now the duration of two RR intervals, if we see from this diagram, is different. If it is so, if RR interval is not constant, then rhythm is not normal, and such condition is called arrhythmia. There are many types of arrhythmias that we will discuss in the next coming lectures. In ECG terms, RR interval is the time between two successive R waves, as we have mentioned, and it represents time taken by one cardiac cycle. And we mentioned that the significance of RR interval is that it helps in the calculation of heart rate. Number two, it helps in assessing rhythm, whether it's normal or not. How can we determine heart rate from RR interval? Heart rate is if we discuss in terms of ECG, heart rate is the number of cardiac cycles that occurs during a 60-second interval or during 1 minute. If the interval between two beats is 1 second, then the heart rate is 60 beats per minute, means means 60 times heart beats in 1 minute or 60 seconds. The normal interval between two successive QRS complexes or RR intervals is about 0.83 seconds. Then we can calculate heart rate by dividing 60 by 0.83, and it gives heart rate of 72 beats per minute. The heart rate from ECG is calculated by two means. Number one, direct method. Number two, indirect method. In this slide, we will discuss the direct method of calculation of heart rate from ECG. ECG paper moves by 25 small squares. ECG paper moves by 25 small squares in 1 second. In other words, it moves by 25 into 60. It moves by 25 into 60 means in 1 minute, ECG paper moves by 1500 small squares. If the rhythm is normal, then we can calculate heart rate by dividing this 1500 by number of small squares in one RR interval, or by dividing 300 means 300 dividing by 300 by number of large squares in one RR interval. If the rhythm is not regular, then we can calculate heart rate by finding the total number of RR intervals during 6 seconds and then multiply that with 10. Suppose if there are 7 RR intervals in 6 seconds, then we multiply this 7 with 10, that gives heart rate of 70 beats per minute. Next is the indirect method of calculation of heart rate, and this is basically a quick method of determining heart rate from ECG. In clinical setting or in hospitals, we use this method. For determination of heart rate by this method, measure the number of large boxes that form RR interval and remember this series given in this table. For example, if there is one large box, if there is one large box that forms the RR interval, then divide 300 by 1 and it gives heart rate of 300 beats per minute. If there are two large boxes, then divide 300 by 2 and the calculated heart rate will be 150 beats per minute. If there are three large boxes, that separates, then divide 300 by 3 and the heart rate calculated will be 100 beats per minute. If four large boxes separate the R waves, then divide 300 by 4 and the calculated heart rate will be 75 beats per minute. If 5 large boxes separates the R wave, then the heart rate will be 60 beats per minute. If 6 boxes separate the R waves, then the heart rate will be 50 beats per minute. In the next lecture, we will study recording of 12 lead ECG and calculation of their electrical potential. Thank you very much for being with us. Allah Hafiz.